Be honest. When was the last time you left your doctor feeling heard? I'm Dr. Sidhu, and I am a family practice and a lifestyle medicine doctor. And today you're going to learn about what direct primary care is. I'm going to let you in on a little secret. When it comes to your healthcare, you actually do have choices. Keep watching this video to see if direct primary care, this new membership model of healthcare, is right for you. So basically, direct care aims to solve three major problems that we're experiencing in healthcare right now. The first one is time. So most of you watching this video, if not all of you watching this video, have experienced this. You're coughing, you call your doctor, they can see you in 3 weeks. That doesn't really help you, right? Or you want to schedule an annual checkup, and those appointments are 6 months out. Or it's you wait 3 months, you get in to see your doctor, and you get like 3 minutes with them. It doesn't feel like enough. Well, direct care is different. In traditional models, doctors have about 2,500 to 3,000 patients. In direct care, direct primary care, a doctor might have between 500 to 800 patients. And what that means for you as the patient is, rather than booking 15-minute slots for each patient and then getting to spend less than 10 minutes with the patient each time in traditional healthcare, in direct care, doctors can have 30 to 60 minutes with each patient. Not only do you get longer appointment times, but it's usually easier to get into your direct care doctor because you're competing with fewer patients. So most direct care doctors can see patients within 24 hours if it's necessary. So let's talk about the second thing that we love about direct care. The second thing is financial transparency. So direct care is based on a membership model. So instead of billing your insurance for every little thing, you pay one flat monthly fee. And that monthly fee includes your office visits, your sick visits, your follow-ups, your checkups, often in-house testing like strep and flu swabs, visits like phone calls, texts, and emails in between appointments, versus the traditional model, they bill your insurance for every little thing. So you pay your copay, you go in, and the doctor says, you need this, this, and this. So you agree because you believe you need it. You get home and you have a surprise bill. Not fun. Direct care aims to remove that financial burden off of patients and create this transparent model. The third thing we love about direct care is that there is better patient satisfaction. So we know a patient isn't going to be super happy if they waited 3 months for the appointment and then got 3 minutes with the doctor. Or if you go in with a list of issues and then you're told that you can only cover 3 topics. Or it's Friday evening or Friday 4:30 and it feels like you have a UTI, you try to contact your doctor and you can't, so you end up paying a ton of money to go to urgent care. We've all been there. These are all recurrent issues in the traditional healthcare model. So direct care aims to improve patient satisfaction by allowing patients to have direct access to their doctor, allowing them to have more time with their doctor so they feel heard. And these appointments and this contact with the doctor is available when the patient needs it. So if you're still wondering, what is she talking about? I don't understand. I get it. Most of what I do during these last few months as I started this practice is tell people what direct care is. So if you're still wondering, go ahead and check out the captions. I linked the website link to my practice, and it'll give you a good idea of what a typical direct care practice might look like and give you more details about some of these numbers and some of these sort of guidelines that most direct care practices follow to make it easier for patients. All right, let's talk about another thing that is amazing about direct care. Direct care generally makes happier doctors because, believe it or not, most of us went into medicine because we want to help our patients. It is our purpose, it is our guiding light. So if we are in a traditional healthcare model where we're getting less time with our patients, we're feeling rushed during our visits, we can see it on the patients' faces when they leave. They're not happy. And then we're spending about 25% of our time on administrative burdens, tasks, clicking, pointing, filling out forms peer-to-peer, and all that stuff. we're not very happy in that model, a lot of us. And so direct care removes a lot of that administrative burden and allows us to spend more time with our patient. Connecting deeply with our patients is a huge part of why a lot of us got into medicine. And so these longer appointment times really allow us to connect with patients, get to know with patients, and really identify what their goals are for treatment. And then we can personalize care. When we personalize care, we have better outcomes, and as doctors, we feel better. So overall, direct care allows doctors to have a smaller panel size, allows us to be more available for our patients. It's fixed prices, so no surprise bills. In turn, patients have more access to their doctors, they know what to expect, and they leave happier. Also, doctors are happier. So, if you are a patient who is frustrated with the current healthcare system, if you are tired of feeling like a number, if you're tired of waiting for 3 months and then getting 3 minutes, direct care might be for you. So let's talk about, okay, direct care sounds good, but how do you find a direct care doctor for you in your area? I've linked some ways on how to find a direct care doctor in your area, and that might help you out in terms of finding someone around you, close to you in your community that might be right for you. In my next videos, I'm going to explain health topics in a way that your doctor might explain if they had time. So many of you might have been there where you get a new diagnosis like diabetes and high blood pressure, and you get the medication, and your doctor might tell you a few things to do, but really doesn't get into the details of what you can do to make yourself better. So I'm going to explain those in my next videos. If you have a certain topic you want me to cover, just leave that in the comments and I'll do my best to cover it. If you liked this video, be sure to subscribe so I know to make more videos like this. Don't forget to hit the like button and share with a friend who you think might need to learn about direct care. Also, if you are a physician watching this and now you've become DPC curious, don't hesitate to reach out and let's chat. I'll see you in the next one.